The new COVID strain Omicron has now been confirmed in Australia. So what does that mean for us? And will the government now rethink the plans it has for loosening restrictions at the border? Joining us this morning is the Prime Minister Jacinda Ardern. Prime Minister, good morning.
Good morning.
So we know you've already made some changes in terms of these 9 countries that have been added to the very high risk list. Are you at this stage anticipating any more changes we will need to make either at our borders or here at home?
Ryan, just at this stage, it is too early to say, but of course we are fortunate that unlike many other countries who have made quite significant alterations at our border, we have a border management system that allows us, when we see issues of concern, just to elevate the classifications of certain countries and require very quickly a change in approach. And we can mobilise that quickly, as we did over the weekend. Of course, all travellers are still required to go through our managed isolation system. Yes, you're right. We had indicated self-isolation for certain countries beginning in January and then more broadly and change in February. But again, all still requiring home isolation because we've always had a concern about making sure we're very careful at the border, and this is an illustration of why. Just on whether or not this is going to change anything, again, very early days, the World Health Organization has said that they're going to be undertaking research to establish really the level of infectiousness, the transmissibility of this variant, and also what impact it may or may not have on vaccines. Early days yet, though.
Yeah, absolutely. So that's January 17, because there's obviously 2 cases in Australia. Now, as you say, we know there are more questions than answers, really, in terms of how bad it is, how quickly it spreads. But January 17 for Kiwis and Aussie coming here and isolating at home, is that going to go ahead regardless, do you think, or could that change?
Oh, we've always made decisions based on the evidence that we have, and so let's get the evidence in before we make calls on that either way. I think what's really interesting here is that you've both got those who are expressing concern that yes, may be more transmissible, but at the same time, the doctor who was part of discovering it talking about a different set of symptoms, milder symptoms than what we've seen before. So again, we need to be prepared for it, either to be possibly more severe, possibly more mild. We just don't know yet. And so I'm confident we'll get that information well in advance of any wider adjustments at our border. And as always, we will be cautious because that has served us well and it's serving us well now.
We're not going to cancel Christmas, are we?
Oh, no, nor do we have any reason
We've
to.
We've got no reason to at this point.
And I think the important thing to remember here is, we've always had settings that will carry us the distance. And in fact, everything we've done has always been around the fact that COVID is very changeable, that we have always expected variants, and our settings are all designed around that as well. So you can see here that that's serving us well.
All right. Do we know how many people from this region are booked to come here? Do we have any bookings in MIQs?
Yes.
How many and when?
Yes, we do. So, look, just to cast backwards a little bit as well, we've had over the last month, 74 travellers. Over the last 2 months, we've only had 5 positive cases. Now, you'll know that when we get a positive case, we undertake what's called genome sequencing. So we'll go and check what kind of variant it is. And of all the results we've had, they've all been Delta. So that's us to date so far. Casting forward, we were expecting over the next few weeks, my recollection is 20 people travelling in. I can't tell you at this stage whether they'll still be eligible to do so. When you're categorised as a very high-risk country, which is what we've done for 9 countries, only citizens can return, and they're required to be in managed isolation for 14 days. Now, some might ask the question, why are we allowing that? We have to allow citizens to be able to come home, but we can put higher restrictions on them, and we are. They'll be staying in managed isolation, and they'll have that rigorous testing.
Are they going to be staying, because in Australia the 2 cases are staying in a special ward of the hospital, will there be a special place for these up to 20 who will be coming from this region in the next few weeks?
And again, up to, again, highlighting that there will be likely those who don't fit the criteria to be able to come anymore, because, of course, those who are permitted to travel into New Zealand are more than just citizens, but we are only under very high risk, only citizens fall under that category. So for those individuals, they will be going into our MIQ facilities. Keeping in mind, Ryan, I'm not entirely clear on whether or not for Sydney they've done something special, or whether or not that's just a reinstatement of their quarantine, because, of course, remember, they've pulled back their quarantine requirements.
They have.
So I don't know whether or not they've done something purpose-built because they haven't had quarantine.
But just so we're clear, ours we'll have Delta in with Omicron, potentially. Like, there's no separate facility.
Well, of course, we treat all cases with absolute caution. Anyone who is positive goes into our quarantine facility. There are no higher standards that we can apply that we do not already have in those facilities. They are very rigorous and careful.
Fair enough. All right, let's move to the Sir Brian Roach report, which came out on Friday, but it was given to you guys in September, quite critical of a number of aspects of our preparedness for Delta. Why did it take so long for the public to see it?
Well, first of all, what I'd say is that some of it, of course, will have been overtaken by things that we've done since. But when we receive those reports, we also make sure that we've got a response. What have we done to respond to the recommendations? What have we done to, enact those things that still require enactment? And so we do pull together a proper response when we release them as well. The other sheer fact is actually the same people who'd be likely responding to the report are doing that in real time, Ryan, and we have been in an outbreak. So we wanted to make sure that we're focusing both on the real time, making sure that we're getting everything right here and now in the outbreak, whilst also responding to reports.
But what would be the harm in the public knowing about it earlier?
Look, I think because rightly you'd ask questions around what we've done about it, and so we want to make sure that we can respond to that at the same time.
So you want to wait until you've responded before you tell us what the problem was?
No, we often make sure that we have a response. It's not unusual at all when the government commissions work to receive that work and say, well, look, what of these have we enacted already? What is our, of these recommendations, which ones of them, have we already put in place? Which ones do we need to do work on and put that response out together? That is commonplace, whether it's an inquiry, a ministerial inquiry or, an ad hoc group. That's not uncommon.
One of the issues the report raises is around ICU capacity, right? Because if we're going to have more outbreaks or whatever may or may not happen in the future, we need ICU capacity. And it sort of highlighted the shortcomings there. I noted a report yesterday from Canterbury, Bay of Plenty and Waitemata DHBs. They have asked, some of them up to 6 weeks ago, for extra funding from the Ministry of Health to get ICU bed capacity up. 6 weeks on, no response.
Well, actually, there has been work done internally on that. Some of those areas, of course, keeping in mind that the issues, it's not just a matter of for ICU capacity in New Zealand. By and large, the issue, is workforce as opposed to physical capacity. And this is something I've heard time and time again. An ICU bed in New Zealand, tends over a 24-hour period, is staffed by 5 specialist nurses. So building that workforce has been a big focus because, again, that is a bigger constraint in many cases than just the physical space in a hospital to put in extra ICU beds. In 2000 budget, 2 budgets ago, I believe, we put in additional funding to do the training to ensure that we had that specialist nurse workforce, that if we were surging those numbers, that we could bring in that workforce quickly. And we do have the capacity to do that.
It's
but
not enough,
when it comes
though,
to the physical space, we have been responding to that as well. But some of that work hasn't been announced publicly yet.
Okay, so these guys will get a response, and it's likely to be a good response. Are you able to say with the nurses, because obviously we're competing with other countries, and if you look at the rates of pay for our nurses, we need 5 or 6 per ICU bed. Why don't we just up the nurses' pay? Would that not be cheaper than lockdowns?
We have, and obviously
more.
that's you. Many may have missed it, but we've had a significant pay agreement with nurses, and we're working on completing pay equity, and that will see significant rises.
We're still not competitive, even with Australia.
Well, perhaps we should wait. Perhaps we should wait for the conclusion of that. But again, we have also at the same time made sure that we have the capacity within MIQ to bring nursing workforce home or into the country as well. Specifically, my recollection is about 300 spaces through to the end of the year, because we do have people coming into the country who are wanting to work in our health network.
All right, Prime Minister, just before we go, it looks like Christopher Luxon, well, he's looking good for Leader of the Opposition. But you actually appointed him, I think, to your Business Advisory Committee. What do you think of him?
You know me, Ryan. I'm not in the business of commentating on the National Party's ongoing leadership issues. I think the public would rightly want me singularly focused on pandemic management, and that is exactly what I'm doing.
All right. Thanks so much for your time this morning, Prime Minister Jacinda Ardern, at 22 minutes after 7.